Hello everyone, welcome to the Movement and Performance Podcast, where it is my goal to help people get active and reconnect with their body. Today I have with me Jacelyn Biondo. She is a board certified dance therapist, researcher, and educator. Today we're talking about dance therapy, using dance potentially as a tool to heal, to communicate, to understand more of yourself and maybe even more of others. So we'll dive into the topic of dance therapy.
Yeah.
We kind of talked a little bit over the phone about what it is, but can you give like a bit of a definition? What is dance therapy?
So dance therapy is the psychotherapeutic use of dance, movement, and the body to inform and promote wellness, and wellness in the sense of cognitive, emotional, physical, spiritual wellness. And so it's a practice that is a form of psychotherapy. I always describe it as being just like a verbal psychotherapy session, except in addition to words, we're also dancing, moving, and using the body to talk through the sessions. And it's a type of psychotherapy that's facilitated by either a registered dance therapist or a board certified dance movement therapist. You'll hear me use dance therapy and dance movement therapy interchangeably. Dance movement therapy is the term that is used now. Dance therapy is the original title of the field. So it's a form of psychotherapy that's practiced by somebody who has a master's level education, specifically in the field of dance movement therapy, who works with clients in a way to promote that holistic wellness.
And I'm assuming it could be a wide range of maybe mental illnesses that you're supporting? Or when we say psychotherapy, does it necessarily even have to be illness?
It doesn't have to, absolutely not. So I think, the psychotherapeutic component is really in the definition of what we do, and we have expanded that in other ways because it's, when we think about physical wellness, so dance movement therapy can be used for individuals who have, maybe some more physical needs than mental health needs, so physical health needs. But it can be used with, I've worked primarily in mental health fields, but you can also do it with children, work in like children's hospitals, work with people who have been diagnosed with cancer or other illnesses, work with people who are normal neurotics that just might want to go see a therapist to maintain wellness, people who have addictions, people who are in a rehab facility. So it really can be used across a vast array of diagnoses or normal neuroses as well, but really there's the underlying thing is that there is kind of a psychotherapeutic component to it.
What makes the psychotherapy component?
Well, I mean, just like any other psychotherapy, we root our work in theoretical frameworks that have been established. So whether that is, based off of the work of Freud, so if you have a Freudian framework, or if you have a framework that's more Jungian from Carl Jung, or perhaps some other practices that would inform your style of dance therapy that have been established in the psychotherapeutic world already.
So is that to like differentiate it from like just any regular traditional dance? Is that when you're using that term, is that kind of put that stamp?
Yeah, so I think there's kind of this meter of how we work, right? So dance, I think, would be on one end, and dance is a form of expression, and dance is something that can be physical, but it also has, anybody who dances understands the benefits of dance, right? Then there's kind of therapeutic dance, where people can use dance for catharsis or use dance in therapeutic ways, but it's not psychotherapy. And then on the other end of the spectrum, I would put dance therapy, which is the psychotherapeutic practice. So you can do dance and therapeutic dance without a practitioner. You can do those things on your own. But in order to be practicing dance therapy, you need a dance therapist, and then you need the client or clients.
So what would maybe, like a session potentially look like?
Really depends on the dance therapist and their style. So I use a very traditional Chasian style. Marion Chase is one of the creators of dance therapy, the profession of dance therapy in the United States. And so what I do is I come in, I talk with people a little bit just to kind of get a general understanding of them, their needs, who they are. And then we would do a movement warm-up, and the warm-up would be both physical and emotional warm-up, so it readies the body and the mind to do the work. And then from there, some theme will arise from the
And
person.
that's with music on?
I use music. Some dance therapists do, some don't.
Okay.
And then some type of thematic processing happens. A theme arises that you explore through the body and through movement and through dance, and that always comes from the client or the participant. And then we do the movement processes, and then we do a cool down to both physically and emotionally cool down and close up. And then there may or may not be time to verbally process about it, or there may or may not be need to verbally process about it.
So I'm almost thinking, I guess, a variety of different things. Like anybody who would go to see I don't want to say regular, but this is me not being well versed in the subject
That's
area,
okay.
but a regular therapist.
Like a verbal therapist,
A verbal
maybe.
therapist, right? That's the word I'm looking for. So like a lot of nowadays, it's so popular. Everybody goes to, or at least it's a norm to seek out a therapist. And we're all kind of struggling with something.
Right.
But anxiety, depression, a breakup, whatever it is. So let's say someone who's coming there and they, I don't know, recently went through a breakup, or they can't find like a good, they want to find a good partner in their life and they can't, or whatever it is. And maybe that's why somebody would go to see a therapist. Their relationships aren't working out for them. So what would a dance therapy session, so would I now kind of be expressing that? Like, what's the goal of that session for me to communicate with my body?
Yes, and
I know
think
that's a boatload of...
it's I mean, the thing about using the body is we don't know what's going to come up.
Right.
And so it's a different entry point. I think that, so as a dance therapist, I go into a session with no plan ever. I never know what's going to happen. And I don't think you can know what's going to happen, right? And I think if you allow space to not know, then you're inviting things in that are unthinkable or unimaginable, which are really magical, right? So I don't know. I would have to feel what that person needs. I would have to see what their body is telling me. I would have to, as a dance therapist, I join in other people's movements. So I try to engage in what they're doing, not only movement-wise, but the essence and the energy and the feeling of it, so that I can understand and I can intervene non-verbally. So it might just be like, I'm frustrated, I can't find a partner, and you have these movements that come out of you, but it also might be, I'm frustrated, I can't find a partner, but the movements that are coming out of you are really saying, I really need to love myself more before I can get into that space. And so how does the body kind of direct the need? Because I think we come in and we say things. I went to therapy, verbal therapy, as an adolescent and just lied. I lied, or I was silent for like a year. And that's not really doing anybody any benefit, but the body can't lie as readily. I
agree.
Yeah.
You whatever it is you're feeling, it's kind of going to be expressed in some way. So would you say then that the body... by the way, even before I get into that, I love that you use the word magical. When I think of the word magic, right, I think of science that's unexplained. So it's real. You just can't explain it yet.
Yeah.
And that's kind of touching into everything we're talking about here. So does the body do you think that the body has knowledge that the brain is not consciously aware of yet?
Oh, definitely.
Yeah.
Definitely. I think there's a couple ways to go about like understanding this. And I think So the way I think of my body and our bodies are that the body is our first home. It's the first thing that we inhabit, and it is our lifelong home. So we store everything in our bodies. We store our memories and our traumas and our fantasies and our dreams and our secrets. Everything gets held into the body. And then that can come out. It can come in and out of the body. And I think the knowledge that the body holds that is not yet conscious is kind of twofold the way I'm thinking of it. First is that we have a lot of experiences that happen to our bodies and us before we are verbal. So when we're in utero, when we're birthed, when we're children before we have language, or if we don't ever acquire language, right? So there's all of these pre-verbal stories and memories and experiences that we can't put to words because there were no words when we were experiencing them. So we have all this pre-verbal knowledge in the body, both positive, negative, and neutral, right? And so the body holds on to those things. And then I also think that when we experience things that are difficult or traumatic or unpleasant, we sometimes, both consciously and unconsciously, pack them down into our bodies, right? We repress, we have repression, we just kind of avoid things. And people, you've heard people say like, oh, I'll just pack that away. Well, where are you you're packing it into your body, right? And then you carry it with you, and you might have so many things packed and layered that it gets suppressed for a while, but it still exists in there. Your body, I think of my body as like this elephant that never forgets. And so when we move, sometimes those memories get stirred up. It's like when you have an olfactory memory, right? You're walking and you smell something and you're like, my grandmother's house, 1979, right? You know it immediately.
Yeah.
And that happens with movement. So we move our body in a way, and that kind of shifts and unearths that memory. So we might not cognitively be aware of it, but our body will let it surface, and then we can process it through the movement.
And is that called neuroception?
Neuroception is a little bit different. Neuroception is our body's way of perceiving relative safety. So when you are walking like down the street and your heart starts racing quickly because you feel unsafe, right? So the heart will start racing first, and then you become aware of the surroundings, and then you might think, okay, this does not feel very safe to me. So neuroception is more of the body's ability to perceive safety.
And it's reacting and then sending the message to the brain.
I believe so.
Right.
Yeah, and I know that they say that like in infancy and in babies, they have the capacity for neuroception when they are face to face with like a parent or caretaker, and that is they'll coo and they'll kind of reflect back or settle in, versus if like somebody had a baby and just randomly handed it to you on the streets, the baby might not feel that sense of safety and might be a little disrupted in their nervous system and might cry or might kind of wiggle a bit,
right,
because of that perception of who's safe and who's not, or what's safe and what's not.
So there's a lot going on that the body's picking up on, and we might not always be consciously aware of, or we may even consciously repress on purpose. Or I always think about the conscious mind as perspective, and a lot of times that's what meditation for me is. It's like choosing my perspective. Am I focusing on my breathing? Am I focusing on this? And so it's almost like a choice to ignore that feeling and shift my perspective somewhere else because I don't want to go into that feeling. But it seems like it's there. Whether even if you choose to take a different perspective and not think about it, it still exists.
It exists.
Yeah.
Yeah. And I think all of that material, all of the memories, all of the experience, they always exist. I would talk a lot with my patients, and when I use the term patients, it's because they were inpatient in a psych hospital. So When I worked with my patients, we would talk a lot about you got to work through it. You can't just ignore it and kind of like move around and keep going, right? The only way to do things is to go through them and to process them and to kind of sit with your things and experience them and allow yourself to move through them so that you can keep what's beneficial and learn from what you can learn from. And then when you process things, you have the capacity to let go of what you don't need to hold on to anymore. I think we hold on to the things as a safety mechanism, right? They're serving us in some way. Whatever we hold on to, even our traumas, that holding is serving us. And so we need to figure out, what is it serving? How do we tease through it? How do we maybe use something more healthful to serve that need versus the trauma?
Yeah. So would there be a way to, for someone to be able to sift through that with their body? So meaning like, there's forms of meditation where you're kind of just allowing to feel it, but then I'm assuming there could be a practice where when you feel whatever it is you feel, to enact it. Maybe like if you feel the sadness, to show the sadness, or would you recommend that what would be a practice that someone could potentially do on their own? Obviously going to a therapist is beneficial, but if someone didn't have access to that, is there any practice they could do at home to walk themselves through this where the body would be helpful?
I mean, I'm always really hesitant to encourage it as a solo practice. I think it's necessary to have somebody with the knowledge and with
the expertise
to be able to support you through it, because I say all the time, and sometimes people don't understand, but the work that you do with your body, which is why I'm always very adamant about people who call themselves dance therapists, dance movement therapists, but don't have the knowledge, or people who are dancers that offer workshops in trauma or things like that. Those make me really kind of retreat, because it's not safe. And what I mean by that is sometimes the body opens up very, very quickly and you can't close it on your own. And you need somebody to walk you through it, to guide you through it, to support you through it, to understand what's happening, to be able to witness somebody in movement and say, oops, something's not right. We need to shift this and intervene, because it can be really detrimental for people, especially people who have kind of internalizing processes. So people who have experienced trauma, people who have a diagnosis of schizophrenia, where the internalizing process really heightens their symptoms in a way that can be detrimental. So I think having somebody there with you who is knowledgeable about the process of moving through and how much is okay to open up, and teaching people how to open and close. Like I always think about my sternum and my ribs, like literally opening and closing to expose my heart. And I think some people's heart is more easily exposed and then we become more receptive. And so teaching folks like about neuroception and when is it okay to let your heart space open, and when do you need to guard and protect that. So teaching the ability to shift and adapt the openness and the receptivity that we have. Because for a lot of folks, they're just open all the time. They walk out in the world very, very vulnerable.
So some people need the opposite, is what you're saying. Like
I think some people need both, yeah.
Right.
Some people need to open up, some people need to close it in, some people need to learn. Some people are either all open or all closed, right? And so it's this notion of the balance, exactly. And like, how do you determine whether it's safe to open or not? How do you determine whether it's not safe to keep closed, right? I worked with first responders for a while, so people who were police officers, firefighters, EMT, and military. And they that I found with them, I'm generalizing, but their space was always very closed. Because if they were open and vulnerable, that meant they could lose their life or their peers' lives.
Right, right.
So, but then when you come home, that doesn't serve you anymore.
Right.
When you're not in the space of immediate or imminent danger, how does that closure affect your relationships with your partners, with your children, with your families, with your colleagues? Right? So,
Yeah.
just learning.
Yeah, I have two directions I want to go with that.
Okay.
One is obviously that then I'm assuming dance can, intervene with that and help with that, or dance therapy. But I wanted to ask a question about I almost feel like there's parallels with like ayahuasca. I don't know, like I know that might sound off for a minute, but meaning, or like those guided, I don't know anything about it. People just talk about it so much nowadays, and but like this guided emotional experience where you're exposing trauma, and it could be too vulnerable or not, or maybe you need some help with it, and having the guide there is important. Would you say that there are some potential parallels, and it's just like ayahuasca but without ayahuasca? Like it's almost like with the body, it's like a more I know that might sound far-fetched of a question.
Yeah,
but
I think my knowledge of ayahuasca is not where it needs to be to respond appropriately to that question. But I think there is something about all of these different ways of attending to people,
right,
that really teach you about facing things, moving through things, experiencing things, sitting with things. And so I think, ayahuasca, from my understanding, will get you there. Right? Dance therapy has the potential to. I think maybe a difference is that dance is this kind of innocuous vehicle that will take you there without being too abrupt. Right? Or we can do work through dance therapy that is entirely unconscious. But because your body is active and moving through it, you are processing, but it's not so overt all the time. Whereas I imagine that an ayahuasca trip might be fairly overt.
Probably. I haven't done it myself, but I just hear a lot about it, and it just made me think of like having someone there as a guide while you're going through this emotional experience, and having their expertise. I guess it just, it made me think of it for a second. So would you say, so that individual before, you said they come home and maybe they're a bit closed off. So dance therapy has the potential to allow them to open up in these scenarios where they might have been a little closed before? Like, have you seen it, improve people's lives?
I have, and I don't want to make dance therapy seem like this cure-all that's just like, do some dance therapy and you're going to be healed, right? But I'll share a little bit of a story about a gentleman that I worked with, and he was ex-military and police officer, and he was really, really kind of held together quite tightly. And I walked into the room, and when I worked in inpatient psych, you don't know folks, and you may work with them one time, you may work with them twice. So I'm not a person that reads charts. I don't believe in reading patient charts. If somebody handed my patient a book of all of my worst features, they might not want to engage with me. And so I give them the same respect of meeting them and just engaging and interacting with people and letting them show me who they are. So I didn't know this person, and I walked in and I said, "Hey, I'm Jacelyn. I'm a dance therapist. We're going to do some dance therapy today." And he, in a very unkind way, said there was no way that he was doing this. There was some expletives used, and he's like, "So what are we really doing?" I was like, "We're really doing dance therapy." And he's like, "Say it one more time and I will come over there and I will punch you in your face." And I was like, my friend, I am going to do some dance therapy today. You are welcome to join us. You are welcome to excuse yourself. This is your treatment. It's a group.
Okay.
And a small group, probably about 6 of us.
Right.
And long story short, I think it was maybe because he threatened to come and assault me, and I was like, cool, do what you have to do. This is what I'm here for. And I stayed. And I think it's about showing up and staying for people, even when they're scared and they threaten out of fear. And so I was like, well, this is what we're doing. And so he initially jumped up and started kind of doing all these really big, fast movements, and was like, oh, is this what you want? Is this what you want? And I was like, that's actually not at all what I want. But, we're just going to start nice and easy. We'll get there. If you want to get there, we'll get there. But let's just breathe together a little bit. Let's kind of do some warm up. So as we're moving through, I invite people to start a movement that we all can join in together with. And I remember him, I remember his movement, I remember where in the room he was standing, and he was doing this movement that was like this. He was standing and he was squatting down and he was doing this movement. And I got across from him and I started doing it with him at the same intensity that he was doing it. And I said, this is really great. It seems like you really like to have things organized. And I just reflected what it felt like in my body and what I was witnessing him doing and what I was feeling from my perspective him doing. I said, it feels like you really like things organized. And I saw something shift in him. So I started slowing it down and kind of shifting the dynamic of what he was doing. And he kind of teared up and he started crying. And he joined me and he said, I feel so out of control. Everything in my life has to be organized or I feel out of control. And he just wept. And there was a bunch of other people in the group, a bunch of men, and they just stood there and we all just held this space for him and just encouraged him to keep moving. And I kept shifting the dynamic of the movement and trying to get him to a place that he felt a little less rigid and a little less organized, but still held. And we ended up finishing the group, wrapping up, cooling down, and I just wanted to give him privacy and space. It was a very emotional moment for him. I stayed in the space for a while. He thanked me for the group. He apologized for his behavior at the beginning of the group. And then 2 days later, I saw him sitting in the common area, and I was walking through, and he was sitting with an older gentleman who was just stacked. And he was like, Jacelyn, come here. Dad, I want you to meet Jacelyn.
Oh, wow.
Jacelyn's my dance therapist.
Oh, wow.
And this giant, very clearly military dad was like, you're what? And he's like, this is Jacelyn. She's my dance therapist. Are you coming to the group today? And I was like, I'll be there. I'll see you later. And so that's a little glimpse into how I think we can subtly help people shift the way their body moves or what their regular movement repertoire is, to introduce and expand new things into their repertoire so that they have them.
Yeah, that's all awesome. It also got me thinking about, there's a book I'm reading called The Extended Mind by Annie Paul. And she talks a lot about gestures and kind of how, you're just making me think of how, that was a representation of something, right?
Yeah.
What he was doing.
Absolutely.
And oftentimes people can communicate it with their body, something's round, but even before they have the words, right, to say it. So it almost seems like this, the piece about gestures and how it's just beneficial in some way, that the body is coming up with this knowledge that it has, and it's expressing the knowledge before you can even put it into words. And sometimes, I have a friend who says this all the time, sometimes there's not even a word to describe the feeling, and now this gesture or this embodiment of it can show it more than my words can articulate it, because words are doing the best they can, but they aren't always as accurate as maybe a gesture. And it seems like it's helping us to learn and articulate and all those things as well. Would you agree with that?
Yeah, and I think also I think about gesture a little bit differently. I studied with Dr. Martha Davis, who is a psychologist and a movement analyst, and one of my mentors, and a brilliant, brilliant woman. And she has done a lot of studying of gesticulation and the way that we use both gesture and posture, so how we lean in towards one another, how we orient towards or away from one another. And so I know gesticulation to be movements of the kind of arms and hands that are associated with language. So verbal language and gesture always go together. From the way I've learned about it. I'm sure there's different schools of thought on gesticulation, but I agree that like I think I gesticulate a lot, and then when I talk about gesticulation, I gesticulate even more because I'm aware of it. But I think coming from my background, like, and my culture, there's a lot of gesticulation in the Italian culture,
Italian, so
right?
I get it.
Yeah. So we understand, and there's I have memories of sitting around the dinner table as a child with like 15 people every Sunday eating pasta, and everybody kind of talking and gesticulating at the same time, and kind of the competing for, and you can see when people start posturing in that they're really meaning something very serious. So I do think there's something really profound about gesticulation that I haven't learned enough about yet. But there are studies that say that when students learn from teachers who gesticulate a lot, they learn better. Because there's an association, there's a body and verbal association that happens simultaneously, and we can express ourselves more completely when we have the capacity for gesturing. So people who are diagnosed with schizophrenia, for example, so for every mental health diagnosis we have, there are a certain set of movement dysregulations that go along with or accompany the symptomatology that people are experiencing. And so one of the things that people with schizophrenia experience is limited gesticulation and limited posturing. And so when you speak to folks with schizophrenia, if they perhaps are in a more chronic phase of schizophrenia where it's been with them, they've been living with it for an extended period of time, more of the negative symptoms of schizophrenia are coming out, then you're going to see a diminishment of movement, and you really can see that through their gesturing and their posturing and their orienting. Even like head nods, like when you and I are talking to one another, like right now you're nodding your head, right? When I'm talking to you, I'm nodding my head, and that's another nonverbal kind of expression, right? It's like, yeah, I hear you, I'm listening to you. And so people with schizophrenia and some other diagnoses as well may have a diminishment of that. So it's like a very kind of limited, no head movement, no body movement, no orientation. I had an entire verbal therapy session with a gentleman who had a diagnosis of schizophrenia where it was just he and he oriented his body like this for the entire session and spoke to me and was really lovely. For an hour, but not once. And I kept kind of like
trying to like shuffle a little,
like scooting my chair over. But then I just was like, this is where his comfort level is, and I'm just going to allow it. And then as he left the set, like it was almost like he had an internal clock. As soon as the session was over, he just stood up. He was like, "Thank you." It was the first group he'd ever been to, and I opened the door and held the door open for him, and he looked me directly in the eyes and said, "Thank you, Jacelyn, this was really helpful." And I was like, great.
Damn, there was another piece that I was just, the piece about learning. It seems that also people, remember more when movement is involved. So kind of tying with that whole piece.
Yeah.
And then you also mentioned that a lot of people have memories that can come out through movement. It just seems like movement and memory have a correlation or something there. Would you say that movement and memory go together?
I think so. Again, not necessarily, my area of expertise, but I certainly know that there are research studies that say, like, when you allow children in classrooms to move their bodies, they retain more knowledge, they learn more easily.
Right.
I think, particularly in the United States and in Western culture, we want to separate the head from the body. And when we do that, we are doing everyone a disservice, right? We're not just these brains that are carried around by this tool. It's an integration piece. And when we allow movement and learning to go together, then things move more smoothly.
Right.
Right?
Yeah, and it almost seems like restricting that, you're almost like facilitating schizophrenia behavior without it. Like if I tell you don't move, right, or don't look at me, don't move your arms, don't do these things that are so natural, I'm almost like, I don't want to say, obviously it's not schizophrenia, but it's just interesting how someone with schizophrenia won't do that. And I wonder what it's doing to kids' brains when we tell them don't do that.
Yeah.
There's something there.
There's definitely something there. And again, you are, by saying don't move when you're learning, we're separating the body and the mind.
Right.
So we're creating a rift. As opposed to saying, wiggle around, let's dance, let's move. I always tell my students when I teach, and I'm teaching college students, so they're adults, but I always tell them, you need to move, take care of your bodies.
Right.
Like, I'm not here to inhibit your learning experience. And so I definitely think the more we can integrate body, mind, spirit, the more holistic we can use our lives. Like, we could use our lives much more effectively if we bring all of ourselves. But these kids are showing us, like, I need to move my body, and we're saying that's not allowed.
Right.
But there's no justification as to why it's not allowed, other than prioritization of cognitive over embodiment.
Right. And is there any reason why you think that might be the case? Why do people prioritize cognitive over embodiment? And do you think that embodiment has this wisdom that's worth prioritizing?
Oh, absolutely. Yeah, I have learned more through my body than through anything else. So I certainly know that we have that. And why? Because it's Western culture. Right?
Yeah.
It's productivity, it's knowledge-based, it's cognitive, it's verbal. The body is very, very taboo in our culture, right? We have completely over-sexualized and devalued bodies in the Western society.
Yeah.
And so in order to ignore all that we have created taboo around, we just cut people off at the neck and say, this is what matters.
Right. Yeah. Another book I'm reading, I love referencing some books, but Behave by Robert Sapolsky.
Okay.
Really good book. But in there he mentions something about people that have interoceptive awareness, and maybe if you could define that maybe for people and few, but people that are in tune with their bodies. He was referencing a study on investors, that investors are actually better at making, like in the stock market or something with something in that realm. I have to get the exact details on it, but they were better the people who were in tune with their body were better investors.
Yeah. And
because they just intuitively knew when it was the right moment, and they did it right away. And they intuitively knew when it was the wrong moment, and they did it right away. And by the time someone else had had to put it together consciously, it was already too late.
Yeah.
And in the stock market, things are quick. It's now or never. Boom, 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 and in a second it's gone. So the people that were intuitive were able to be better investors. And it makes me think, like, we always prioritize the brain and the cognitive component, and I think the reason we under-prioritize the body is because it seems too easy, like in the sense of like it's general, right? Like feelings, and they're also magical. Like we said before, it's kind of like harder to put science on it, or science nowadays it's becoming much easier, but it's a little general, meaning big picture, right? Like it doesn't take much explanation. My feeling, I just feel it, and I kind of know right away. It's you know, and it takes less processing. So, you know, someone sounds so smart when they can articulate something, but you know, I do wholeheartedly believe that the cognitive, along with the intuitive and that embodiment piece, and the body provides this wisdom that the brain just cannot and cannot pick up on. And you really need to be in tune with both, I think, if you want to move effectively in the world. And it seems like dance therapy so I want to say that dance therapy would help you to be more in tune with that. And would you say that dance therapy can do that? Like, is it someone's born with, or can they build it?
No, I think we all can build it. I think everybody has the capacity to grow and to learn. And whether that's learning cognitively or learning through your body, we all have that capacity. So I was thinking as you were talking, because I'm a researcher, and so things really move into research ideas for me. And it's the same with like quantitative and qualitative research. So quantitative research is really prioritized in science because it's numbers and it's math, and people assume numbers don't lie. And so it's just objective. There it is, right? But the reality is numbers lie, and people can manipulate numbers many, many different ways. And, you know, it's one way of looking at things, and not everything can be measured by numbers. Whereas qualitative research is about words and qualities and people's experiences. And it's less valued in science because people think that it's subjective and therefore it has no value. And so it's kind of like, you know, the cognitive and the embodiment, and the quantitative and the qualitative. And I'm a big fan of mixed methods research. That's the type of methodology I prefer. And so I think that both of them, and integrating both of them and using both of them in a way that enhance one another and teach us the most is really the way to go about it. But you had asked about interoceptive awareness, and so this awareness or understanding of the body from the inside out. So internal senses that are understood and perceived by the body to understand oneself in a different capacity. And I mean, of course, the more we use our bodies and the more we expand the capacity for what our bodies have, whether that's emotive or creative or in the form of an expansive repertoire of movements, the more we practice those things, the better we're going to get at them. And so I certainly think interoceptive awareness is something that can be taught, that can be practiced, that can be developed, that can foster with support. I think this is something that dance therapists have known forever. And I think more recently researchers, dance therapy researchers in particular, are really trying to get some data on that. So I have a study that I'm in the process of facilitating that is using dance therapy as an intervention for individuals with schizophrenia, specifically in order to foster and improve interoceptive awareness and mind-body connection.
Very cool.
And interoceptive awareness is very diminished in people with schizophrenia because of some of the bodily disconnect that they have. Same with people who have experienced trauma. Their interoceptive awareness can be diminished a bit because of that purposeful disconnect of body. There are other dance therapy researchers, Dr. Rebecca Diederich Hartwell and Dr. Minjung Shim are both researchers who have conducted research on interoceptive awareness and have shown that they're small studies, but it is establishing a foundation to show that by doing dance therapy, you can improve your interoceptive awareness. And then when you have greater interoceptive awareness, to follow up on the last part, I absolutely think we're going to have enhanced experiences, right? The gray matter in our brain is also in our gut. And so our gut can inform us of things, and we can make choices based on our gut that are scientifically proven to be kind of cognitive-like experiences or decisions. So when I worked with students, I would say, you don't really have a lot to be afraid of when we're working in the psych hospital. We're just working with human beings. Don't be fearful. But if your gut tells you something's wrong, you need to listen to that. So people think it's intuition. I do think it's a deeper connection with your interoception and your body responses that when we listen to them can inform us much more deeply.
Yeah. Wow. There was so much there. And it's funny. I get my brain goes off on 20 different tangents.
Yeah.
And I'm sure you can understand. You kind of said it with the research piece. But one of the things it made me think of, I was thinking of this movie, and I know it sounds off at first, but it'll come right back.
Okay.
But it was Adam Sandler movie. It was a funny one where the guy he said he has no feeling in his foot.
Okay.
And he sticks the thing in his foot, or he says, he tells the guy, put the, I don't know, it was like a fireplace, and it was like a sharp object, whatever it was, I forgot, the thing that moves the wood
poker.
around. There you go. And he says, stick it in my foot. And he's like, I'm not sticking it in your foot. And he says, stick it in my foot. And then he finally sticks it in his foot, and he makes believe, and he screams as if he was hurting. But then he says, no, I'm only kidding. It actually doesn't hurt. But the point of being aware of the pain can protect you, right? Because now I can move away from that thing. So if you're not in tune with that,
right,
you'll get the thing stuck in your foot, and you won't even know. You'll be sitting here with something in your foot, and you'll just kind of be like, la, la, la. And people think, it's good that you can block out pain, but it might be bad if you're avoiding, if you're not able to get away from scenarios that are harmful to you. Right.
And that's exactly what inspired the research that I'm doing, because the other part of it is that people with schizophrenia have a really high comorbidity of somatic disorders like heart disease and diabetes and things like that. Their levels of the comorbidity is really profoundly incongruent with general population. So they have these diagnoses very, very very high rates. And they often don't get to the doctor for diagnosis or treatment until the disease is so far advanced, because they're not even aware that something's wrong.
Yeah.
They're not acknowledging, I'm having these chest pains, or I'm having these other pains, or something doesn't feel right in my body. So the intention of this study that I'm doing is, if we increase mind-body connection and we increase interoceptive awareness, can we support these folks in getting medical care sooner so that the mortality rates are lessened?
And while you're looking at that with schizophrenia, I'm sure it can apply all the way down
to
lower ends of that spectrum.
Yeah.
Down to, we talked about relationships before, identifying and knowing and feeling like when something is not right, a relationship is not right, and when to walk away from it, or when to stay. And so now I'm also thinking about, so that's the pain, but then also I would think pleasure.
Yeah.
I would think that being more interoceptively aware of what's going on in your body, you'd probably also experience more pleasure in the world, I would feel like. Is that,
I mean, I would say yes, definitely. Right. I think it's just a more full experience overall, right? We feel more pain, we feel more joy, we feel more elation, we feel more anxiety. We are just able to feel more. And sometimes people will kind of categorize emotions into good and bad, and I never do. I think all emotions are good emotions. I think emotions are meant to inform us. They're cues. So if we want to feel more joy, then we're also going to have to be able to tolerate feeling more pain, and vice versa. So I think in that sense, then you want to be able to identify pain if something's wrong with you. And the benefit of that is that you get to experience more pleasure when pleasurable things are happening to you.
Right. then it also, and then the last piece there would maybe even be empathy.
Yeah.
That if I can also be more aware of that. I forgot where I read this one. It might have also been Behave, but people will mimic. People who are more aware of that. I'll kind of start to maybe mimic some of your body postures, and that's a sign that I'm able to feel what you're feeling because I'm doing what you're doing.
Right.
But people will be more empathetic, and then the benefit of empathy, we're social creatures.
Right.
So if you can't navigate social relationships, it's going to be a hard life for you. Like, politics are around for a reason, right? Like we're political, we're relational, we're social beings is what I'm getting at. So that empathy piece is not just about, I think, understanding what someone feels, but it's also, how can I navigate relationships when I can feel what other people are feeling?
Yeah, that's a really huge part of what we do as dance therapists is work on and understand empathy between two humans. And I think, so what you're talking about, like kind of turning the body towards or picking up on gestures or postures that somebody else is doing, is something that we very intentionally do in our practice of dance therapy. And it is a practice that we call kinesthetic empathy, right? So you're attuning to somebody on a physical or embodied level versus just saying, oh yeah, I understand what you're saying. Oh, you just shared that thing. Yeah, I had a similar experience, right? Instead, we're actively embodying that, and we use that as an intervention. And what I shared before about the veteran,
I was just thinking of that.
right? I mirrored his movements, and mimicry and mirroring have different intentions, and mirroring as a tool that dance therapists and others use is very intentional about, like I said, it's about the structure, it's about the timing, it's about the essence, it's about the energy, it's about all of those things. It's not simply the movement, but it's building all of those things to really join with someone and attune to them to create a space of connection. You really, when you're moving with somebody like that, you feel seen. You feel like somebody really truly sees what you're saying or what you're doing or what you're saying through doing. And it creates this attunement that then allows a space for connection, community, relationship, belonging.
That's interesting. That makes me also think of, I don't know why my brain went in this direction, but like the benefit of a concert. When I go to a concert, I'm probably choosing it because I identify with that music in some way. So maybe if you're, go to a rock concert where it's very, headbanger type of rigid, or if you're in Afro beats and you're kind of more flowy, or you're in something else, whatever it is, then you're there with people who also are vibing with that, and it's kind of like a room full of people that understand you,
right?
Almost,
right?
Or at least in that moment.
Yeah, there's also this other, like taking it a little bit out of the path is intersubjectivity, which is sharing unconscious material between two people in an unspoken way. So there's kind of an intersubjective experience happening at things like concerts, because you all are kind of experiencing the same thing and you're in that energetic space together, and there is the capacity to kind of, there's cohesion, and you can, once you cohere, you can kind of shift unconscious energy together. And that comes up a lot in dance therapy when I work with folks, that you share an experience and you can share unconscious material without speaking, through a movement level or through just an energetic level. And I think that's possibly what's going on in these concerts. I also think there's something really profound about just being in space with people, and we don't do that as much anymore. And so I think just that in and of itself is really significant in the process of feeling cohesion with another person, or feeling attuned to another person, is just we take for granted being in space together now, I think.
I agree. And it's not happening enough. Maybe some people more than others, but if you're in the typical, more electronic world, we start to lose some of that embodiment piece. I had a friend
definitely.
I had a friend at work that was advocating that all of our, no offense, Orlando, but I love him and he loves me, so we're good and we can. But he was advocating for all the meetings to be virtual, and I couldn't articulate why, but I was like, no, there is a difference, and we had a whole meeting on what are the differences between. And why should we, and we were trying to figure out, should we do it in person or should we do it virtual? And I was like, oh man, I don't know if I can articulate it in this moment, but something just don't feel right. And it's like, yeah, but everything's happening, right? You're getting the same message. You're getting the same.
You're not.
And now I can feel like I can articulate. You're not. Yeah.
You're definitely not.
Yeah. And what might be missing before I go on a rant?
I mean, if you're doing Zoom, you've got a bunch of little boxes of faces. You're missing everything from the neck down.
Right.
You're missing the gesticulation, the posture, the energy, the connections, the dynamics, the relationship, the attunement, the connection, all of it. Like, I am through and through like a relational person. Like, I will not do therapy online. With somebody. I will not do dance online with somebody. I will definitely not do dance therapy virtually with clients. I don't feel it's safe. I don't feel it's effective. And I don't feel it's not the way that I practice dance therapy. And I can only speak for myself. Everybody has their own thing. The way I practice dance therapy, it doesn't exist in virtual space. It exists in relational space. And therapy, to me, exists in relational space and partnerships and colleagues and everything exists in relational space. And so, I mean, how many times, who turns on their camera even anymore? So now you're not only staring at like a box of somebody's face, you're staring at a box of their name. And you know that they've got 20 other things going on at the time. Right? I can't be present in virtual space. But when I'm here, like I have sitting talking with you, I have no desire to check a phone, check an email, no desire to be looking at something else, right? It's because there's relationship happening. And it's present and it's...
There's so many cues that are lost. We've talked a lot about the interoceptive awareness. There's exteroceptive, but there's all these senses for a reason. Even smell's now not there anymore. Pheromones or something like the chemicals that might be releasing without you even being able to see them or know. Or like you said, the lower body. I can't tell what's going on down there, and for all I know, you could be completely stiff, or you could be doing something else that might be a signal to something. But yeah, so another piece I wanted to touch on was, I don't know if we can categorize it this simple, but I don't know where exactly I got it from. I felt like I was watching one of your videos where you mentioned some of them, but dividing up like for example, improv dance, group dance, and mirroring dance. I felt like those are three big one. Like, are they different? Would you use them in different scenarios? Do they have different benefits? Like mirroring versus group versus improv? Is it worth it to separate them into categories in any way?
I mean, it could be, I guess. I feel like when I'm practicing dance therapy, I use all of them. I work mostly in group settings when I work as a dance therapist because I prefer it. And I mean, I worked in inpatient psych and it was an acute care, so they don't really promote individual therapy because it's more about crisis intervention and kind of management of symptomatology to get people out of crisis and into their next step. So individual stuff has the capacity to tap a little bit too deeply into personal stuff at a place where when you're in crisis, you can't navigate that stuff very easily. So, but I also prefer group work. So improvisation, I think it's important. Improvisation, I liken to free association. If I'm will mention Freud a bit because I am a very Freudian-based clinician, although I know that's like a dirty word in many people's minds, but I'm not into like the psychosexual stuff that he was talking about before he had the biology to understand what he was talking about. But I do use a lot of Freudian psychotherapy in my practice in that I'm looking at intersubjectivity, I'm looking at transference, countertransference, I'm looking at images and metaphors and symbols and things like that. So free association is when you just say the first thing that comes to your mind without really putting too much thought into it. It's kind of digging into the unconscious. And I liken improvisation to that, where you don't know what's coming next and you don't plan for what's coming next in improvisation. You just react or act just kind of spontaneously. And I think that that's a really beautiful tool to help people understand how to cope. Right? I always say improvisation is embodied active coping in the moment, especially when you're improvising with other bodies or other people or other energies or other dynamics, right? So if I am improving with you and you're doing something that makes me feel very, very uncomfortable, I need to figure out how to navigate out of that situation, or I need to figure out how to kind of join you and bring you to a place that I feel more comfortable in, right? So it's active, it's quick, it's tapping into the unconscious process to teach you how to navigate different circumstances.
I like that.
And also, you know, when I'm improvising with people, I say, just don't stop. Doesn't matter what you're doing, just don't stop. And it allows people to practice not disengaging, right? So that's, I think, a beautiful tool for coping and for like sustaining. And group, I think, is really beautiful because of dynamics, and it teaches people how to navigate different people's dynamics. And if you get along with or don't get along with or gravitate towards or move away from, or I always think of it as choreography as well. Like if I'm a dance therapist and I'm facilitating a group session and one person is refusing to join us and they're just doing their own thing, I'm not going to be like, you get in here, do this. Right. I think of them as the soloist in that moment. And then I encourage their solo, because when you go see a performance, sometimes there's a soloist amongst the ensemble.
Right. Right.
So now they're the soloist. So you encourage that, you support that, you promote that, you kind of lift that up for them and praise them for taking that solo. And then maybe at some point they fall back into the ensemble, right? Or sometimes there's little duets or trios that kind of move out from one another. So it teaches you how to step into solo or leadership or authority roles and relinquish from them. It teaches you how to move towards dynamics that you appreciate and move away from those that you don't, without, again, completely disengaging. So it teaches you dynamics and how to navigate systems. And then mirroring is something that can be really useful in developing kinesthetic empathy, in helping people tolerate relationship. Sometimes people can't tolerate, and you see this in children, they can't tolerate face-to-face. It's too intense. So you just go side by side instead, right? Or maybe you go face-to-face, but you expand the distance between you. But it teaches you how to tolerate being with somebody. It teaches you how to communicate with somebody, be in relationship with. And I've seen this really beautifully in sessions, you know, with people who are dealing with substance use disorders, who maybe have rifted relationships with their families or their partners because of their use and because of their addiction. And it teaches them how to get back in and be in relationship. Or it teaches them how to move out of relationship when that relationship is no longer healthy or serving them.
Are there any body postures that communicate things to you in any way? So meaning like, and not that you could go through a whole list, but I guess like turning away is like disassociation, or like not wanting to be there maybe, or being, are there any certain postures or gestures or things that communicate things to you? And you can't go through, there's so many, I can't even, but are there a couple maybe that maybe you can think of?
I mean, I think like the more perhaps known posture that I would say is if you concave your chest and kind of sit in this kind of retreated heart position, this might denote that somebody is more depressed or sad or sullen, right? Whereas people who have the capacity to protrude their heart space or their chest open might exhibit a bit more pride or a bit more ego strength. So I think when we work also, like, the verticality, I think says a lot. Verticality says a lot about how we're feeling about ourselves, in my opinion, and in dance therapy opinion, right? So the less vertical you get, the more diminished we become emotionally and like with regards to self and identity. Whereas when we shift upward, that's kind of a bit more of a presentation of self. So similarly to how I was talking about opening and shutting heart space before, when people need to protect their heart, they will retreat their heart. When people have the capacity to hold in their heart, they might open it a bit more.
Quick time out.
Sure.
I just noticed that light went. Okay. We're going to start to close anyway, so I'm just going to plug it in quickly. Yeah. And then if there's maybe one more question, I'll ask it, but if not, we'll close it. All right, and we are back. So the last question I wanted to wrap up with here is dance something vulnerable? Or why do you think it's vulnerable? And then how can we create a safe space for people to be in so they feel comfortable enough to move in vulnerable ways?
I think there's a couple parts to the vulnerability piece. One is what we talked about before a little bit, is this idea of Western culture kind of making the body taboo. And so I think that there are a lot of notions that we have about bodies that inhibit us from using them very freely. And I think if we want to look at it in the binary, right, which I don't love to do, but if we want to look at it in the binary, even from childhood, young girls are told that their bodies are sexual objects and their bodies are objectified, even in childhood, even very, very early on. Between society and media, young girls are told that their bodies are objects and that they are sexualized and that they serve specific purposes. And those purposes are not things that any child should be considering, right? And then boys are told that they have to be strong and they have to move their bodies a specific way, and that if they move their bodies in a way that insinuates any femininity, that is wrong and that is weak. And then children who are non-binary or transitioning gender or questioning gender are told that there's really kind of no right way or for them to kind of fit neatly into, and I'm just speaking about societal terms, I don't buy into any of this by any means, right? But it's the body is so confusing for children in our culture. And there are such specific associations that happen with the body for children that they become so fearful of moving their body in a way that's not allowed by society, that they will rather not move their body at all than explore their bodies in authentic ways. The other thing is, I think about, when we think about art forms, artists, like fine artists, painters, have a canvas and paints and an object that they separate from themselves. Musicians have instruments and they have recordings and they have sound that is created. Dancers just have their bodies as their tool, and that makes it much more vulnerable because you can't separate yourself from it. You can't say, oh, that's a bad painting, I'm going to get rid of it. It becomes a bad body to some people. So I think partially due to societal norms that need to change and the inability to separate from your vehicle or from your home makes dance much more vulnerable for people. And just, it's the least appreciated art form, I think, in a lot of ways, because it scares other people. If people don't feel comfortable in their bodies and they see people who are very comfortable in their bodies, that makes them feel discomfort. It heightens their discomfort. So I think there's a lot of projection from people who are disconnected from their bodies onto people who may feel connection to their bodies in a shaming way. That also inhibits us from fully investing in our bodies. And there's a lot connected with aesthetics of our bodies, right? I think there's a bit more openness in different artistic aesthetics and different musical aesthetics. But in bodies, again, speaking to America, there's a certain type of body that's good and there's a certain type of body that's bad. And so I think that also lends to it. And so what I think needs to happen is, if you're inviting people to move bodies, children to move bodies, clients, patients to move bodies, you have to create safety in space for them. You have to model it yourself. You have to show them that it's okay to move your body, and you have to show them all of the ways that it's okay to move your body. There was a lot of talk in the hospital about what was okay to do in dance therapy and what was not okay to do in dance therapy. And my rule is that I never say no unless it's harmful, unless it's detrimental. But if people, I had a patient that got so excited in dance therapy that they jumped up on one of the chairs. And instead of saying, no, you can't be there, I said, cool. What's the perspective like up there? Can I join you? And I jumped up on the chair with them and I said, do you think maybe we can hold hands to keep each other safe up here? And then we played with the idea of perspective, like, how does it feel to be up here? How does it feel to be above everybody looking down? How does it feel to be up on a place that, you may or may not be able to be out in the lounge or at your home or wherever, and you just explore yes ands. Or there was a big thing about whether or not it's acceptable to let your patients twerk in dance therapy. And when I first started as a clinician, I was like, twerk-free zone, man, keep your booties to yourselves. This is not happening. And then you let
the twerk go?
Then I let it go because it's cultural. And it's not, as a white person, it's not my job to tell somebody that they can or cannot move their body in a certain way if it's not harmful, right? And I can't project that, that's sexual, onto somebody else. If I think somebody moving their body is sexual, that's on me. That's not on them. And so I was very new in the field when I would, say, nope, not allowed to do that. And then I questioned, wait, why am I saying they're not allowed to do it? It's because I have discomfort because society told me that that's not allowed. And as somebody who promotes body wellness and body health, that is allowed. And so I had to just say, hey, you can do whatever you want to do as long as you feel safe and as long as you're keeping other people feel safe. But then as a dance therapist, I have to also step in and say, you may think what you're doing is safe, but is there some underlying trauma that you're re-triggering or you're re-traumatizing yourself in order to relive it in a way that's detrimental? And then, right, that's where the whole idea of you have to have the knowledge and you have to have the person there to contain it in a way. But I think the creation of safety and the allowance and the not shaming, and it's as a dancer, as a woman, as somebody who moves her body, I shame people. I have had a history of shaming people for moving their bodies, and I had to really check myself on that. And now I come in from yep, you can do that. Yes, you can do that. Yep, I'm going to join you in that. Yes, we're going to do this together. And everybody's going to do it, and we're going to normalize the body again, at least for that hour, and at least in that space, these things are okay to practice and to try out and to explore.
And for those that are maybe too nervous? Are you able to guide them in slow?
Yeah, absolutely. I think it's going back to the idea of choreography. Like, we need an audience.
Right.
The audience is just as important.
Right.
Like, you can't come and be a voyeur,
Right.
but you can sit on the outskirts. I've had groups where everybody was dancing and there's one person sitting on the outside of the space that we're dancing in.
Right.
And you just acknowledge and you just invite and you just, you hold that space for them and you let them know that, verbally and non-verbally particularly, if and when you're ready, there is space for you to join us and the invitation will always be open. And I'm not going to force you to get out of your comfort zone too much. I always say, like, I poke a lot with my clients and I'll poke them and be like, you sure you don't want to dance with me? And, there have been people that are like, I'm not doing this. And I'll be like, all right, duet. And I'll get up and I'll start, like, they're sitting there and I am standing right here and I'm dancing with them and I'll grab their hand and I'll spin myself and, understanding where I can poke a little bit and where I can draw them in. And sometimes I can't do it. Sometimes one of the other clients or patients needs to do it. And I've seen that happen too, which is really beautiful when they won't respond to me because I'm an outsider, which I get, but one of their peers will put a hand out and all of a sudden they're pulling them in and they're having a dance.
I love it. There was one more question I thought of. Of course, that always happens.
That's okay.
But there was a piece about, I was watching a documentary a long time ago, and I just got back from Jamaica. I love to dance. And when we were there, we went out dancing, and I was doing a lot of mirroring with someone there. It was actually a gentleman who was like doing some moves, and he saw that I was kind of like doing it too. He's like, come, like, do it with me. And I was like, okay, now I'm doing the exact move he does. And he was like, surprised I was able to pick it up. He gave me another one. He's surprised I could pick it up, give me another. And we just kept going. I mean, he gave me move after move all night. And it was a great experience. But I came back and I was watching this documentary and it made me think of the moment where they said dance has the potential to create a self-other blur.
Yeah.
It's like a moment where you just lose this sense of self and you're just connected.
Absolutely.
Yeah.
Yeah.
So you would agree with it?
I would agree with that. And I think, as somebody who's danced forever, like, the most intimate relationships I've ever had with another person was in dance. It was not in partnerships per se. It's always in dance. And the way that you can connect with somebody through the body is really the most profound intimacy I have experienced. And I do think that you do begin to blend a bit. And then, like I was talking earlier about intersubjectivity, where you start to, your unconscious starts to mix with other people's unconscious and you have a shared experience in that. And then also, I think, again, I know I'm speaking a lot about schizophrenia, but I think it could be in a lot of different ways. Like, people who have a diagnosis of schizophrenia sometimes have a diminished ego, diminished sense of self. And what I think I do sometimes is I share my ego with them so that they can try it on and see what it feels like. And then I slowly back away and let them kind of keep hold of a part of it. So it's like ego sharing, in that we meld a bit through that kind of unconscious sharing of ego. That's really, really beautiful. But I do think, similarly to being at a concert, right? When everybody's kind of like when you watch it, you see the bodies kind of in this rhythm in flux together, right? And in dance and in groups, that happens. The energy and the movement and the rhythm starts to cohere in a way that's everybody moving together. And there is that mixing of self-other that is really remarkable, I think. And yeah, I've felt it with, like, when I danced professionally with my dance partner, when I took classes with certain people, certainly doing contact improvisation. I did a contact improvisation with somebody that I'd never met before, and we improved, and it a lot of contact, and it was maybe like a 20-minute thing, and we both were just like I felt drunk when our bodies separated. I was just like, oh my God, like what just happened? And we couldn't tell like where one body ended and the other began, or who was initiating and who was following, or if either of us were, or if it was just this weird like attunement on a deeper level that dance provides, the body provides for folks, that it plays with boundaries.
Absolutely. Yeah, I couldn't agree more. You know, part of me wanting to, like, really exploring and reaching out to you is also probably some of my passion for dance or movement or physical expression, or and nowadays it's just so limited. You know, people don't dance as much. Like, I think about even when I was growing up, and I hear stories of my father. We're all born and raised Brooklyn, but where he was in the neighborhood, they were going out, and people were always connecting in person. People were going out dancing all the time, and I just watched that dwindle a bit more and more, and especially after COVID. And I still go out and dance all the time because I almost want to say I self-treat, right? And, you know, I still go out and do it, but I feel like it's an area that lacks a bit and is almost not normalized. Like, to the point where you're saying, you know, people think, oh, you have to go out and drink and you have to party and maybe you're a party animal. It's like, no, actually just enjoy the that connection, maybe that empathetic moment, the feeling, the improvisation when I'm there, the connect, and I can go out and dance and not drink or do anything, and I could be there. Recently, one thing I've done, I had a couple of friends that went out, and I just wore shades, and I never would wear, I was always say, like, who wears shades at the club? That sounds so stupid to me. But I did it, and now I kind of felt like I understood why. As a martial artist, I never put them on because I always wanted to be aware of my surroundings, and to be in a place too dark is no good. But it almost shut off my visual sensation, where I felt like I was able to be more intuitive. I felt like I could be more interally receptive, or what the word is I'm looking for, but I was more in tune with myself. Yeah. And it's almost like I closed my eyes, I felt the music, and I was just in it. And I think people need more of that, and it needs to be a little more of a norm to dance without alcohol or drugs, or whether it's at home in your own house or with friends and out in a group or at a therapy session, just moving your body.
Yeah.
So
there were tons of times I was working on the addiction unit, and I would be like, I'm the dance therapist, we're going to dance today. And they would be like, there's no way I'm dancing without drinking. Like, the two go hand in hand. This is going to be a trigger for me. And I actually had one person who would bring a cup of water into the session and dance while holding the cup of water, because that satiated the need to hold liquid and drink while dancing. And it was kind of like his stepping stone, like his security blanket, until eventually he was able to put the water down and just dance and understand that, because I do think there's certainly an association with drinking or using drugs and dancing. And it is because of the vulnerability. It's because of, you know, the inhibitions that we have in our bodies. And I do think we need to get back to a place of feeling okay with connecting with our bodies. I think when we drink and when we use, it numbs a little bit enough of our body that we don't have to connect to it. Right? It numbs it, it tingles it. Okay, it's feeling pretty good. Now I can do things.
Right.
Whereas we need to get to a place in society where we love our bodies, and we are proud of our bodies, and we express with our bodies without shame and without fear and without guilt of doing that, of indulging in the body.
Yeah. I was thinking the other day too, not to go too off on sidetrack, but I wonder if when people do go out and they do drugs or do these other things, and some of the benefits that they say they feel, I'm sure it's from the drug itself too. But I wonder if it's like, okay, you now are comfortable enough to actually dance in a vulnerable way.
Yeah.
And you're actually probably feeling a lot of the benefits of dance and not just the drug. Whereas if you could do it without it, and it takes time.
Yep.
But so I'm gonna close it. Wow, that last one went off one more time, but that was literally just went off at the end of my sentence. All right, Jacelyn, thank you so much for being on today.
Of course.
I really enjoyed being able to have this conversation with you. You welcomed me into your home, which is super nice. Thank you for your hospitality. And that's all for today.